They've tested about 50 people, and they have the capacity to test 40 people a day, according to a spokesperson. Local news reports Friday said that it was awaiting confirmation on a positive test case from one patient. The CDC, which is in Atlanta, has sent the state one test kit, which the health department has estimated will provide it with around 150 tests. According to the spokesperson, this differs from the estimate of 350 per kit. In Hawaii, they began testing late last week, and they are capable of doing 250 tests per week. As of this week, there have been at least 6 negative results. There have been 72 people who are self-monitoring with public health supervision, 65 of them on the island of Oahu. Idaho has enough testing supplies for about 600 people total. With an influx of testing supplies from the CDC just this week, and it can test 15 to 20 patients per day. As of Friday, 27 people had been tested, and 36 were being monitored, with no positive results as of yet. In Illinois, as of Friday, they had done 185 tests, with 5 confirmed cases and 2 recovered. The state of Illinois has materials for 2,000 tests and has asked the CDC for more. In Indiana, public state health officials said they have tested at least 12 people, and they reported its first positive case on Friday, according to local news reports. A spokesperson said its state lab is using kits that were issued by the CDC only. In Iowa, as of Friday, they had conducted 17 tests total, all negative, and they are waiting on 2 pending results. The CDC performed 2 of these 5 tests, and the remaining 3 were performed at the State Hygienic Lab at the University of Iowa, which has supplies provided by the CDC. A university spokesperson said that their lab is capable of testing about 500 patients. At what rate, the report does not say. In Kansas, they have received the CDC's test, and they used it for 11 people, all of whom tested negative. In Kentucky, as of Wednesday, Stephen Stack, their public health commissioner, said that 10 tests had been conducted, 1 positive and 9 negative. 3 of those tests were done by the CDC and 7 were conducted by state officials. All future tests in Kentucky will be done in state labs. The state can test close to 1,000 people. The state has been able to conduct testing using modified CDC tests since today, according to the commissioner. In Louisiana, as of Friday, they have completed 5 tests within the state lab. There have been no confirmed cases in the state. In Maine, as of Friday, they had recently received new testing equipment. Its health and environmental testing lab is calibrating the equipment and is positioned to do testing within the next several days. In the meantime, it has sent approximately 12 samples to the CDC for testing. It did not have problems with the initial tests it was sent by the CDC. In Maryland, at least 41 people have been tested, with 3 positive as of Friday. Maryland hasn't been able to start testing until this recent Tuesday. A spokesperson said the state has an ample number of tests at this time, but was unable to provide a specific number. In Massachusetts, in the first 3 days of the week, epidemiologists responded to more than 1,000 calls from people who thought they had symptoms, according to a spokesperson. The number of people tested there to date is not clear, but at least 8 people are presumed or confirmed to have the virus as of Friday. The Massachusetts State Public Health Lab said it had an adequate number of tests, and it is able to meet the current demands for testing. Michigan received its first test kit from the CDC on February 8, and then 2 others on March 5th, which are still being validated. Until then, the state has testing capacity for about 300 people. It can test about, pardon me, Michigan can test about 86 people every 8 hours. It initially encountered issues with the CDC test, but the revised test is now working. As of Friday, at least 8 people have been tested, 5 by the CDC and 3 by the state's Bureau of Laboratories. All were negative. The state added it has ordered a test kit from an undisclosed commercial vendor, but has not received it yet. According to a spokesperson, we have ordered a test kit from a private vendor and will be working through a validation process once we receive it. If the process is successful, we will provide our results to the CDC and the FDA for approval to use the kit for testing for COVID-19. Each commercial kit costs $234 per 500 reactions, according to the spokesman. In Minnesota, as of Friday, at least 49 tests have been done, 49, with 48 negatives and 1 positive. Minnesota has 3 test kits and said it can test about 400 people per kit. Sarah Vetter, who manages the infectious disease lab for the Minnesota Department of Public Health, estimated the lab was capable of running 400 to 500 tests per day. It received the first test kit in February, which was faulty, though Vetter said it was now working. A second kit arrived last week, and a third in early March. Mississippi did not answer questions about how many patients it has tested, but it did say it had tested 14 samples. There are 0 confirmed cases in Mississippi to date. That state has received 1 test kit from the CDC, capable of running 225 tests. It initially had issues with this test, but their current regimen is functioning. The state has ordered more kits from the CDC. In Missouri, they have the capacity to test about 800 patients, according to their spokesperson. The state has tested 12 people, and another 9 cases were sent to the CDC. There are 0 confirmed cases in Missouri to this date. In Montana, at least 11 people have been tested, all negative as of Friday. Montana has received 2 test kits from the CDC to date, the first a few weeks ago, and the second on this last Thursday. In Nebraska, at least 23 people have been tested as of Friday, with 0 positive results. In Nevada, as of Friday, they have tested at least 14 people. It has the capacity to do more than 600 tests using materials from the CDC, and they received an additional 800 tests from a commercial provider early last week. It can run about 100 tests per day, according to Mark Pandori, director of Nevada State Public Health Lab. In New Hampshire, as of Friday, 25 people had been tested, with 0 positive results. In New Jersey, at least 22 people have been tested, with 18 negative tests and 4 presumed positive, according to a spokesperson. Of the 22, 5 were tested by the CDC before a New Jersey state lab was conducting testing. The state has received 2 test kits from the CDC, 1 in February and 1 last week, and said it's able to test about 216 people with each kit. New Mexico received a test kit February the 8th and another last week. It said it was able to run a total of between 1,400 and 2,000 tests. Like other state labs, it initially encountered issues with the CDC's first test. As of the end of the week, it had tested 16 patients, all negative cases. A spokesperson for New Mexico's said, "We have yet to reach capacity. The number of tests we would be able to do would be dependent on the number of shifts required." In New York State, they have tested at least 278 people, with 29 positive cases, 68 negative, and the rest pending. BuzzFeed News reported last week that the state of New York was developing its own test after the CDC's had proven faulty. This week, the state said it was using a test developed by scientists at the Wadsworth Center, which will soon be able to perform testing for thousands. In addition, the spokesperson said a number of commercial labs and large hospitals will also be able to test very soon in New York. As of Friday in North Carolina, they had reported 2 positive cases, though those test results had not yet been confirmed by another lab. As of Friday in North Dakota, they had received supplies for 100 tests from the CDC. It is capable of running 50 to 100 in a given day, with the capability of doing more as needed. North Dakota has not tested anyone yet. In Ohio, as of earlier this week, they had not received test kits from the CDC, 0. But they are hoping to receive them this week, according to a spokesperson. The spokesperson said when the test kits were sent last month, Ohio did get one malfunctioning test kit. And they continue to work with the CDC to get the test kit that is current. As of Friday, 10 people have been tested in Ohio. 8 of them cleared, 2 of them pending. I imagine those were by the CDC. In Oklahoma, since the last week of January, they have sent 6 samples to the CDC for testing, 5 negative, 1 pending. Oklahoma received test kits last week and is validating them now. Once they're up and running, and they gave no timeline, the state expects to be able to run 100 tests a day, according to the spokesperson. Oregon has received 2 test kits from the CDC on February 8th and February 29th. It has not had issues with the tests. It has the capacity to run about 80 tests a day. As of Friday, at least 95 people in Oregon have been tested, with 3 positive and 64 negative. Pennsylvania is currently using a test kit sent by the CDC in mid-February. A spokesperson said, "As many state and local health departments did, we did have issues validating the test kit originally. But the tests are now up and running in Pennsylvania. The state has the ability to test 20 to 25 samples per day and expects to see that number increase in the near future with added equipment. It is not releasing the numbers of people who have been tested in Pennsylvania." In Rhode Island, as of Friday, they had tested at least 21 people. Rhode Island has not had issues with testing capacity, said their spokesperson. There are at least 3 confirmed cases in Rhode Island. In South Carolina, they have received 2 kits from the CDC, one during the initial release in February and the other last week. And they are successfully testing after encountering issues with the first kit. They are capable of running 80 to 100 tests per day, and they have so far run 5 tests. In South Dakota, they have conducted 5 tests, and all were negative, according to the state's Department of Health website. State officials did not respond to repeated requests for more information. In Tennessee, they have tested at least 8 people.